that's fine. You can be comfortable.
Okay.
Well, Marcy, thanks for talking with us today. We're talking with Marcy, who is a patient of Dr. Griffith's here at Vital Healthcare. And Marcy, I wanted to ask you about your medical history and what brought you to see Dr. Griffith originally.
Well, I have a family history of cancers and also neurological diseases. I myself have been probably battling arthritis, osteoarthritis for at least 20 years. And that basically over the 20 years in the last few years has brought me to Dr. Griffith.
Okay. So Marcy, give me a description of the symptoms that you had with the osteoarthritis and how did those symptoms affect your life?
Well, at first it just starts out with aching in not the whole body, but just certain parts, either shoulders, necks, hands, sometimes the knees. It slowly progressed, getting worse over the years, to the point of I finally had a total knee, a total hip done orthopedically.
And Marcy, what kind of other treatment options have you tried over the years that you received through your conventional physicians? Were there other things that you tried to deal with the pain?
Yes, I've tried injections, steroid injections. I was kind of, in a way, the guinea pig, whichever was the newest one they tried on me to see did this help or did this not. And I've tried that, definitely have tried aspirins and ibuprofen, NSAIDs, and but it just seemed always to get worse.
So how did you come into contact with Dr. Griffith?
Well, part of my own treatment has been massage, to have massage. That seems to relieve it. And it was encouraged by my regular medical doctor. My regular PCP, private doctor, preferred provider, retired a few years ago. So I spoke with my massage therapist, pretty much being in her position, same office, and I asked. And so therefore she referred me, because I thought I changed my own eating habits and just health-wise, and I thought there has to be more than just taking artificial drugs. It's basically it. That would also cause damage to other parts of the body, kidneys, livers, etc., while trying to hold off the deterioration of the arthritis. That's how I came to see Dr. Griffith.
So Marcy, when you saw Dr. Griffith, what did he recommend for you as a treatment for your osteoarthritis?
At first it was just working with herbs, mainly going to the health food store and working with that. There was some leaving, but then it was suggested of the IV DMSO. And so I thought about it. It was something I wasn't sure I wanted to do. I at first used just the liquid out of the bottle and used it as topical on, if the knees were acting up or the hands. And I used that quite a few months, and it seemed to work, but again it wasn't lasting. So then Dr. Griffith and I spoke more about what would be involved with the DMSO IVs, and I decided on doing that.
So you decided to go ahead and start having some DMSO infusions. Were there any side effects that you noticed?
One of the things during the treatment, which is about an hour long, I felt so relaxed. I wanted to take a nap, and the first two treatments I definitely did, and the other ones I didn't because Dr. Griffith was in them. He was chatty. But otherwise, that's one of the symptoms was that it was very relaxing. So that's a plus. And I felt very, very good. For at least on the first treatment, it lasted for about 5 days that I didn't have the aching, and then it slowly came back. I've had 4 treatments, and definitely by the end of the 4th treatment, which I would have a treatment once a week, definitely felt very good. The swelling in joints, especially knees, ankles, had subsided. So that was very good. The only thing bad about it is that I've been told by others, especially my husband, that there is an odor. And my husband says that it is mainly when I talk. So it must be coming off the breath. Otherwise, he doesn't smell anything, and he says it smells somewhat like canned corn. I don't use canned corn too often, so I'm not sure how that is. But it only lasts a day and a half. But the problem is that I do have a job that I have to talk all the time. So I usually have my treatments on Friday, and usually by Sunday, my husband says he doesn't really smell anything. So that's the only negative part about it.
So Marcy, how do you feel about your experience coming here to see Dr. Griffith? Do you view it as a positive experience?
I honestly will come and do the treatment again. I've only had the 4, but even that, it's been over 2 months, and I'm just beginning to feel the symptoms of my arthritis at this time. I don't know whether it's because the weather is a little bit warmer, but I can feel it again, and because of the relief, I definitely will have the treatments again, and hopefully we'll have more duration of a time than just 4 treatments. I have already recommended, because I find it, besides the smell of the canned corn, there isn't any other side effect that is negative. I've also, because the information is online, been able to go in and see what DMSO really is, what it is all about. I feel very comfortable that it is natural, and you don't have to worry about the destruction of other parts of your body, liver, kidney, etc. And I'd rather do my health as organically as possible, as God has wanted it. And I've already recommended to a family member of ours. He happens to have rheumatoid arthritis. My symptoms are very similar, but I've never been diagnosed myself, but because of my effect with the treatment, I've recommended it for this gentleman, and he's already gone on medicine, but I've read about that pharmaceutical medicine, and again, it's going to, in the years, destroy the kidney or the liver. So I'm hoping he will take advantage of this. He seems to be very excited. It's mainly getting the time to come and do it.
Excellent. Well, we certainly appreciate your confidence in the care that Dr. Griffith has given you, and that's definitely demonstrated in the fact that you do talk to your friends and family about it, and so we really appreciate that. And we just want to let people know, from your own words, that you're not being paid or compensated, but you're speaking about your own personal experiences here at the health clinic.
No, I'd really like to help spread the word about this particular treatment. I think it's an excellent alternative than just popping a pill that you hope will work with your body. So, no, I'm here of my own free will and through an invitation, and I'm glad to give my testimony on it.
Thank you so much, Marcy.